Natural disasters can strike at any time and in any place. Hurricanes, tornadoes, floods, tsunamis, earthquakes, and volcanic eruptions all have one thing in common. They disrupt every part of a community's life. When these events happen, hospitals and emergency systems can become overwhelmed within hours. Nurses must be ready to act quickly, think clearly, and deliver care in situations that may have limited communication, power, and clean water. After a natural disaster, one of the biggest challenges isn't just the number of injured, it's the loss of basic systems we take for granted. Electricity, running water, and cellular service may all be gone. Wireless technology, computers, and even phones may fail. In those moments, disaster plans shift from theoretical documents to the guiding framework that saves lives. The first casualties after a disaster are almost always trauma-related. People are often injured by collapsing buildings and by flying debris and fires. Hospitals should anticipate 3 waves of patients. The first wave includes the walking wounded, people with minor injuries who arrive on their own. The second wave brings in those who are severely injured and need immediate intervention. The third wave arrives once rescuers begin pulling victims from collapsed structures or isolated areas. Unfortunately, these later patients often have the most severe head or chest trauma and require aggressive resuscitation or critical care. The timing of these waves means that nurses and trauma teams must pace their resources and energy. Even days after the initial event, patients may still arrive, especially those hurt during cleanup efforts. Disasters don't end when the storm clears or the shaking stops. Let's look at the types of natural disasters and the kinds of injuries or issues they cause. Earthquakes often produce multiple aftershocks and can trigger tsunamis. Buildings in earthquake-prone areas must be tethered for stability, but even with safety measures, injuries are common. Victims often suffer fractures, head injuries, dehydration, and pulmonary problems from dust and debris. Flooding can follow storms, hurricanes, or dam failures, and often leads to community-wide destruction. Victims may drown or suffer injuries from debris in the water. Floods also spread waterborne and vector-borne diseases such as E. coli, hepatitis A, leptospirosis, malaria, dengue fever, and giardiasis. Nurses should expect both physical trauma and infectious disease outbreaks afterward. Hurricanes bring a dangerous mix of flooding and tornadoes. Failure to evacuate is a major risk factor for mortality. Afterward, recovery activities such as clearing debris with chainsaws lead to many injuries. Food and water contamination are common, and nurses may also see stress-related disorders, animal bites, and gastrointestinal infections. Tornadoes are particularly dangerous because of their minimal warning time and high travel speed, often around 30 miles per hour, covering 20 kilometers or more. They cause massive destruction, displace entire neighborhoods, and leave victims with crushing injuries or blast-like trauma from pressure changes. Tsunamis occur suddenly and bring massive waves of water onto land. Injuries often come from debris and rapid submersion. Afterward, diseases such as cholera and vector-borne infections can emerge. Volcanic eruptions bring hazards like lava flow, ash, and toxic gases. Ash can spread up to 20 miles from the eruption site, causing respiratory problems, burns, and even acid rain exposure. Beyond the initial physical injuries, natural disasters leave long-lasting environmental and health challenges. Without safe shelter, people are exposed to extreme temperatures, contaminated water, and unsafe food. Rescue workers face their own dangers: exposure to the elements, unstable buildings, and encounters with animals like snakes, spiders, or alligators. Safety gear for responders must always be available and properly used. Injuries from equipment such as chainsaws or from building collapse are common. Hypothermia can set in quickly when workers are exposed to water below 75 degrees Fahrenheit, even in warm climates. Mental health support is equally important. Disasters are traumatic for both victims and responders. Communities need shelters, crisis counselors, and access to behavioral health resources to manage grief, anxiety, and post-traumatic stress. Veterinary assistance is another overlooked piece of disaster planning. Pets are often left behind or injured, and managing these animals safely is essential for community recovery. Early warning systems like tornado and hurricane alerts have saved many lives, but not everyone heeds them. Some people don't evacuate because they lack transportation, don't believe the threat, or simply refuse to leave their homes. Nurses can play a key role in public education by emphasizing preparedness long before disaster strikes. When buildings collapse, rapid response is critical. Every minute counts in finding and rescuing survivors. Water-damaged structures must be inspected by experts before re-entry, as they may be unstable or contaminated with mold and toxins. Long-term risks after natural disasters can be just as deadly as the initial event. Without clean water, proper waste removal, and vector control, diseases spread quickly. Public health workers must address sanitation, purification, and the safe removal of human and animal remains. Even chemical, biological, and nuclear materials can pose risks if they've been disturbed. Natural disasters test the limits of every system, but they also reveal the strength of nursing. In the midst of chaos, nurses remain the bridge between medical response and human compassion. Whether stabilizing a trauma patient, protecting a responder from exposure, or comforting a family that's lost everything, the nurse's role is essential. Preparedness, adaptability, and calm leadership save lives long after the initial impact.